Welcome back to Retire Hour. This episode, we're talking about transitioning into retirement and the different topics that you can get into, whether it be the financial, whether it be the emotional, whether it be rewiring yourself in retirement. Today, we have one of our Medicare team here, Trey Bassa, and he is we're going to talk about Medicare and contributing to an HSA account at the same time. So let's start with HSAs. What are those?
HSAs, health savings account. If I know one thing about HSAs is that they are tax-free. People like to build up their HSAs, and they like to establish themselves for those big medical mishaps that might come down the line. Like, I know I have a HSA myself, and I'm putting away a little bit every check to build up into that HSA for anything that might come down the line. So that's the one big thing, is that it is tax-free. Contributions, withdrawals for qualified medical expenses.
Well, you hit on a topic that's very near and dear to everyone's hearts, and that is tax-free. So, but are they available to everyone? And if they are or aren't, whichever one, am I limited? Can I use an HSA for my grocery bill or what have you?
HSAs are dependent on like your workplace insurance and what the group health coverage can offer. I know that some plans at work will have a higher deductible for a lower premium, and then some places will have HSAs as well as contributions from the workplace, and building up that little egg a little bit more. As far as how to use them, the groceries is not a qualified medical expense.
Okay.
So think more along the lines of blood tests or some sort of medical surgery for your shoulder.
Copays,
Doctor's visits.
prescriptions.
Yes.
Okay.
Yeah. All of that would be considered a qualified medical expense in which you can withdraw from your HSA tax-free and use that money for those expenses.
Awesome. Okay, so I'm hearing you say, or are you saying, that not every employer may offer an HSA to their employees. Is that fair?
Yeah, that's fair.
Okay, so, but if you do have one, so let's talk about why it's important to coordinate the ceasing of paying or stopping the paying into the HSAs with choosing when you want to retire or when you go on to a Medicare plan of some sort. Talk about that.
It's all a part of a grander plan. A lot of people don't realize that if you have an HSA and you continue to work past 65, you can keep that HSA and contribute to it, but cannot start any part of Medicare. As soon as you do, Part A or Part B, you can no longer contribute to an HSA, and there are some tax implications that may come of that. We do recommend a 6-month period before retiring that you stop contributing to an HSA. And here's why. There is a 6-month look-back period. So as it goes, Part A has this kind of retroactive period. So as soon as you put in an application for Medicare, you can potentially have that back written about 6 months. And that's the exact time period that they're going to
Start looking.
Yeah. So recommend 6 months in advance before you hard retire. Stop those contributions.
And so this is a question more for the CPA, Joshua Sikora, which I'm going to bring him in here in our next segment. But let's talk about, there is some teeth or there is some penalties if you continue to pay to an HSA. I had a client one time that was still working for his employer, and he had been on Medicare since 65 through his employer, but he had paid in his HSA all the way to age 70, which is his current age, because he was still working. And so that was kind of a nightmare to unwind for him.
That does sound nightmarish. The tax that we're kind of hinting at today is called an excise tax. I believe it is a 6% excise tax on any contributions made between starting Medicare and when you actually cease that HSA contribution. 6% on the excise tax, and then that was the tax implication I was talking about earlier, and Joshua will be able to talk a little bit more about that.
So in that, if someone finds themselves in that situation, if they are for some reason they have gone on to Medicare, sometimes you don't know what you don't know, and that happens a lot with people who are wanting to step off into the retirement world. They didn't know in the government regulations that is Medicare, that is the HSA system, that whether you're supposed to get that through your HR, through your current employer, or is it your responsibility to just do all your due diligence? Some people, they're lost on where to gravitate towards. So that's where working with someone from Market Medicare Advisor, that is our job. That is their job to sit down with you and say, okay, where are you at today? Larry and I spoke in a prior segment together about a lot of times people want to retire around when they're eligible for health care away from their employer, which would stand for Medicare. So most people are eligible for Medicare for the first time at 65. There's some exceptions to that. But so if they could retire prior to 65 because they were eligible for health care somewhere else, then they probably would jettison the workforce sooner, or they think they would. I'll say it that way.
Yeah.
They're still testing the waters, as it were. But they forget to think about what's the things that I don't know about my health care coverage. We concentrate so much on money and how much money do I have and where's it going to come from, and am I going to have enough? And Larry and I were talking in the last segment, and when people sit down to retire, I often will ask them. I'll say, What's the day of the week when you're working that you spend the most money? So let me just ask you. I have not asked you this question. What day of the week do you mostly spend more money?
I get paid weekly, so it's payday.
It's payday.
Yeah.
Okay, so when you're working, you can't spend it, right? Or not as easy, unless you have some automatic deductions going on.
Yeah.
But most of the time, when you're not working, so your weekend, if you will, you probably spend more money, whether that's on bills, groceries, fun things to do, whatever. You probably spend more money on the weekends, right?
Yes, absolutely.
When you retire, every day is the weekend. So that's the problem. So people have a hard time understanding, what am I supposed to know about Medicare when I'm eligible for it? Hey, I'm eligible for it at 65. Let me go ahead and start on that, because now I can get rid of that higher expense health care that I've had through my employer, or maybe I can get a broader coverage with Medicare than I get through my employer. But they forget to figure out, oh, by the way, there's some coordination going on with the HSA. So that's where, again, Trey Bassa, Mark, Corey, we have a great team of Medicare advisors, both here and in Kansas City, that will help understand what you need to know before you make those decisions. And so I just tell you that if you don't have this complete team working for you, please give us a call at 833-888-HOUR, or that's 833-888-4687, and sit down and please book with us a 1-hour free consultation. We'll be happy to sit down with you, or Trey and his team will sit down with you and tell you the things that you need to know before you just step off into Medicare. It's a whole lot more than just knowing which plan to choose.
Absolutely. I love the way you put it. You don't know what you don't know until you come in and you talk with an advisor.
Well, Trey, thank you for your time today. Let's go to break, and we'll come back on our Block C.
Got retirement questions? You can submit your financial questions to be answered by the Retire Hour team by going to retirehour.com and clicking Submit a Question. We may even answer your question on air. Visit retirehour.com to ask your retirement questions today.